Good afternoon, everyone, and thank you for joining us today. We'll start promptly at 12, and please let me know if you are able to see my PowerPoint on the screen. Just give me a thumbs up in the chat box or a yes, or come off of mute. Great, thank you so much. And Teresa, I see some folks are joining within the Microsoft Teams meeting. I'm going to go ahead and just put the link to the Zoom within that for them. Oh, thank you. And I see you beat me to it, so even better. And we have some folks still coming in. So we're going to give just a few minutes before we get started. And I have some colleagues that are going to be watching the chat box, as I cannot see the chat box at this time. But please share your name. If you prefer credentials, feel free to add those, your organization, and email within the chat box. That way, if there's any outstanding questions at the end of this, we can make sure to share all the resources and information with you all. So thank you again for taking the time, potentially during your lunch hour, to join us for this presentation. I'm also going to put the link to the pre-survey into the chat box to make sure that if you have not yet been able to complete the pre-survey, we'd greatly appreciate it. We really want to understand the community and the attendees that we're speaking with today, and to be able to learn from you all. And so I'm going to go ahead and drop that in if it hasn't been done so already. It's nice to see some friendly faces on here, recognizing a bunch of folks. Let's see. Okay. So I've just shared the pre-survey. So if you have not done so already, feel free to go ahead and do that. It should take about 4 minutes at the most, depending on your responses. And we'll get started at 12:05 exactly. And I just realized I have my volume off. So if you've been talking, I apologize. So I'm going to go ahead and just run through what you see on the screen right now. Again, if you're just joining us, please put your name. If you want to share your credentials, go ahead, your organization and email within the chat box. This will allow us to make sure that if you complete the survey and do want continuing nursing education credits after today's session and or tomorrow's, that we can provide you with those, and also making sure that we are able to follow up with everyone that does attend and share this PowerPoint and any additional resources after today's session. And so today is day one out of the 2 days of our Lunch and Learn series for school nurses, and getting back on track with adolescent wellness visits and vaccines. And today we're really going to go over the impact of the pandemic, the past year and a half, call to action for a variety of different types of attendees. We're going to have a Q&A session at the end of my presentation, just so that we have enough time at the end to really have a full discussion. I'm hoping to have about 20 minutes for some open Q&A, and then also we'll be able to share some resources with you all. So this PowerPoint will be emailed to you all after the session. There are some slides that I will run through fairly quickly, but no worries. You'll be able to dive in a little bit deeper if you are interested once you do receive the PowerPoint. And again, Trelisa and other colleagues within ACS, if there's any immediate needs within the chat box, please let me know, as I cannot actually see the chat box at this time. But I would also like to just give a thank you to my American Cancer colleagues and all those represented on the screen for day 2 panel, but also all the individuals that helped promote these 2 sessions. We're really excited, and we're gonna go ahead and get going. As I see, it's 12:06. So again, we're gonna hold the Q&A till the end. So you're all gonna be stuck listening to me for the next approximately 30 minutes. But there'll be plenty of time for some interactive activities throughout the session utilizing the chat box. So my name is Rachel Coughlin. I am a senior program manager at American Cancer Society. I'm located in Austin, Texas, and I manage a privately funded project called Mission HPV Cancer Free Texas. This project was launched in 2019 with a focus on implementing a multi-component HPV vaccination project within 26 counties in North Texas, but also with a statewide focus. And we really want to, in the next 2 years, expand and grow this project into collaborating with independent school districts, school nurses, and local community partners that can help impact the uptake of adolescent vaccines. So we'll go ahead and get started. And so again, on today's call, if you missed in the beginning, we're going to be reviewing kind of the state of vaccination wellness visits right now after the year and a half of being in a pandemic, and some calls to action for different populations and participants and attendees on this call. We'll leave, I'm hoping, about 20 minutes at the end of my presentation for just open discussion and Q&A. We have a variety of attendees today with expertise, experience, and just general knowledge to help answer any questions. So I'm definitely not the main expert on this call. So anyone on here, feel free to answer and speak up on any questions or topics that may come up at the end of this presentation. And then we did want to put together a variety of resources that can be shared out in the community to reflect what is being discussed today. And so first, we're going to discuss pandemic impact. I think we all felt it in a variety of different ways. The implications of the pandemic on healthcare provisions last year were really systematic in nature. And, we saw cancellations of appointments in early spring, systems shut down, especially pediatric departments. Those providers were then shuffled over to other areas with really high need during the large increase in COVID impact to help with providing additional services to those within hospital systems. We were encouraged and required to stay home. Many of you may still be at home working from home in this new virtual atmosphere. We had health systems and schools having to figure out how to operate in this new environment, developing new workflows and protocols, and maybe even you just at home developing new workflows and protocols to managing your family while working from home. And the CDC called on systems and the community to prioritize infant and adolescent child visits early in 2021 because of some of the large deficits and compliance issues that we are facing around vaccination. And meanwhile, like I mentioned, parents were asked to work remotely and homeschool their children, learning new methods of math that I don't have children, so I fortunately didn't have to teach anyone other than maybe getting some new puppies. And many of these students have not yet returned to in-person learning. So that's going to be a big adjustment for not just the children, but the families, the schools, and the systems that collaborate and help out with those processes. And so really, this is just a shocking statistic to me. The CDC, as of May, stated that over 11.7 million doses we're down by 11.7 million doses compared to 2019. Other than influenza, that was something that wasn't directly analyzed. And vaccines for children, this data directly comes from those provider ordered specifically. And for those of you that are attending, please make sure to mute your lines. Thank you very much. We do have some colleagues that are on mute patrol, so if you can't find how to get off mute, we do have some assistance from others on this call that can help with unmuting you or muting you. And really, the gap is largest for vaccines primarily given to adolescents. And so one large thing, this is just substantial to me. So this is in comparison for immunizations provided by Vaccines for Children programs across the country, comparing 2019 to the 2020 and 2021 fiscal year. And so right now, both with HPV vaccinations and Tdap, we are down 18%, which is substantial for just approximately a year and a half impact of COVID-19. And we're down 14% with meningitis vaccinations as well. And later on in this presentation, you'll see why this is, so substantial to not just school systems, but the health of our community and preventing these preventable diseases that we have control over. And this graph here is really, it's only showing up to 5 years old, but as you can see, these are really important times where children are often going to consistent wellness visits. But as you can see, as the age gets older, the missing of wellness visits are increasing. And we see this even more drastically when it goes into adolescent visits. And so this data is from about 7,000 caregivers that reported between April and October of 2020. And we see a really disproportionate data representative between caregivers, voices of Black, African Americans, Latino communities, and those that fall below the federal poverty line. So those that already were at a disadvantage or having health equity issues, we're seeing that even higher now due to the pandemic. And so one thing that I want to point out is that this data analysis is not weighted, but it shows a good representation of what we're trying to get across here. Then you see here, there's a lot going on in this graph. And really what I want you to focus on is that circle that shows a number 1 and then number 2. The first US case of COVID-19 was reported at the line where number 1 is, and that was in Washington State. And then circle number 2 was when we actually had a US national emergency declared across the nation around COVID-19. And the blue lines that you see are actually weekly provider orders from the Vaccine for Children programs in 2019. And then the orange is the ordering for 2020 and 2021. So you can really see that after circle number 2, there's a huge discrepancy in ordering, and the ordering starts to rebound a little bit into February 2021, but there's still a large gap. And that is something that we really want to take notice of. But there's still a substantial deficit as we're halfway through 2021, and you can just see where we were in early 2020. And this is showing weekly orders in comparison in 2019 and how low we are. And again, this is documenting that 11.2 million vaccine doses that we are down. And this does not, again, represent flu. And just with meningococcal, we are down 1.4 million. And we're actually seeing a slower recovery in vaccine ordering within the private sector, which is a really interesting thing to take notice of. And this again kind of really plays on missed wellness visits that I mentioned in a previous slide, and how lower income households are significantly more likely than middle upper income households to have difficulties making preventive healthcare visits or just general vaccine visits. So we really need to look at the rates of disruption to preventive healthcare based on race and ethnicity, even more so now than ever. And this is always something that we need to take notice of. And so overall, the difference in ability to attend wellness visits based on income were really pronounced among white respondents with lower income versus middle upper. And so this is just to give perspective in, job status and also where people work. If they're a high need employer or employee that were not able to work from home or are working multiple jobs. And really all of this data has an impact on obviously returning back to school, which is why these 2 sessions we're having today and tomorrow are incredibly important, but also just the general health of our communities across the nation and the general impact that vaccines have on creating a stable and healthy nation. And so the next few slides, we're going to be really looking at what do we currently know? What is the state of vaccinations as it relates to COVID-19 and some of the compliance issues with adolescent vaccines and wellness checks. And so I'm going to run through these fairly quickly because it's truly saying the same thing, but I wanted to make sure to show representation from different organizations. And so before, this was probably early 2021 when the vaccine was really more readily available. The recommendation was that their COVID-19 vaccine could not be co-administered. It had to be alone, and it had to be within 14 days or after for any other vaccinations. And of course, before the COVID-19 vaccine. So you had 14 days before you receive the COVID-19 and 14 days after to receive any other vaccine that you might need. And the one thing that I really want to point out is that we have substantial data being collected on the safety of COVID-19 vaccines, and it's authorized by the FDA. But now that some of the recommendations have adjusted and now are allowing co-administration of COVID-19 vaccines simultaneously, we don't have strong data around that, but we do have extensive experience with very similar vaccines that have demonstrated immunogenicity and adverse event profiles, like I said, similar to when vaccines are administered simultaneously or as a bundle approach. And so there are great opportunities for us to catch up utilizing the COVID-19 vaccine opportunities among our adolescents. And so this kind of provides very similar recommendations I just mentioned, but through the CDC, and that we now can be administering COVID-19 and other vaccines without that 14-day before or after the COVID-19. So it allows more opportunity for wellness checks and going in for your normal screening and physicals. And then this really just says the same thing about the age group of 12 to 15 with Pfizer, but I wanted to provide this link so if folks want to read more into this and the safety and protocols around this. This is from May of this year. You can feel free to click this link when you have the PowerPoint yourself. And then this is really important too, is that the American Academy of Pediatrics actually spoke out and approved that clinical considerations should be taken when providing the COVID vaccine, and that really the co-administration of vaccines, whether it's at a local school clinic, a vaccination event at schools, or in collaboration with a local health center, or just with educating students and parents, that co-administration can really help fill that gap of catch up that we need and compliance among our school required vaccines and the optional vaccinations. And again, this goes into what I just mentioned about AAP's recommendations. And there's some really great information about how to advocate for yourself and use this information when going in for your appointments or within your organization to support the policies and protocols you may adjust. So I think the biggest thing is, why now? You know, it's been a crazy year and a half, and we've been aware of the decrease in vaccinations across the board and screening in general for adults. And so the yellow line you see here with the big peak and it's circled, that's historically where we see the highest time of vaccination well visits during the summer. So really it starts at the end of July, and then mid-August is the big peak. And that's when our school clinics, our local hospital systems are kind of overwhelmed by the amount of vaccination wellness visits that are happening before the school year. And so our goal is, how can we get ahead of that and really start promoting and recommending that parents schedule appointments for their kids early on, rather than right at the end of August and into early September. And so this, most importantly, is that because now that teens 12 and up are now eligible for COVID-19 the vaccine, there are different protocols within hospital system settings and school clinics. Some approve bundling and co-administering the COVID-19 vaccine with other vaccines. Some do not, and they want that to be a separate appointment. And so I'd love to see in the chat box, even though I can't see, but I want to look at it later, if you work in a setting that provides shots in arms, whether it's local health department, a health center, hospital system, a school clinic, are you providing the COVID-19 vaccine as a bundled approach? So co-administering it during a well visits, or are you requiring that to be a separate appointment? So if you're co-administering, please put yes in the checkbox or in the chat box. And if you are not, just put a simple no, and I'd love to get an idea of what's happening out in the communities. And another thing I would love to learn too is a lot of schools are considering requiring COVID-19 for fall acceptance into schools and making it compliant for a required vaccine. And so if your school is or is not requiring COVID-19 vaccine, I apologize, please put that in the chat box as well. Yes, requiring COVID-19, no, not requiring. And again, this isn't going to be traced back to you and your organization. It's just going to be a general review of the list of yes or no's, just to get an idea of what's happening. And then this, to me, is probably the most important part of this entire presentation and why you're all here today. And truly, it's because the time for action is now. We need your help to close this school-age vaccination gap, whatever your role may be. And, we heavily wanted to promote this opportunity and this series to school nurses and school administration, because as vaccine rates are declining and cases of vaccine preventable illnesses are actually increasing, we really need parents to have reliable information about safety and efficacy of childhood immunizations and the accurate tracking of their child's vaccination record. And it's becoming even more important now with the COVID-19 vaccine. And so the power of school nurses, you are equipped and well positioned within the community to provide not just reliable information, but also sharing the efficacy and safety around childhood immunizations. And two, you have regular access to students and are trusted by parents. The CDC reports that about 95% of children and youth attend school. It's going to be interesting to see what percentage of youth end up coming back in person full time over this next school year. And we really want to be able to assist and help and make sure that compliance rates are back to normal when we go into the new school year, and how we can assist throughout that process. But then also too, school nurses have a unique vantage point because they do have access to state registries to facilitate this compliance to immunizations, identify students that may not be meeting their compliance for vaccines, but also in the event of a disease outbreak, specifically, we went through COVID, how can we be tracking that within schools and prevent duplication of any sort of vaccines that may have been lost or destroyed and misplaced? So in short, there is so much power, not just through school nurses, but through schools. And there's so many different avenues to partner with your local communities. And that's truly where I see independent school districts and individual schools being able to step up and be a voice and advocate for resources or needs. And so things that can be done within the schools is sending out reminders to families about immunization requirements, especially if there's any new protocols, following up with families if their children are not meeting compliance, which is within the requirements of their school. And then also, how do we explore the registry capabilities? And so there's opportunities in the future where we can potentially educate school nurses and those that have within the school system access to MTRAC2 on how to better utilize that system and make it advantageous to your review and revision of compliance rates. But also, do you have immunization processes and protocols? If so, have they been updated? Is the HPV vaccine a part of that as a recommended vaccine? And so I'd love to see in the chat box, do you know if your school, or let's say, have you seen or reviewed your school's immunization processes and protocols? If not, is it because one doesn't exist, or what might be the barrier there? And a lot of these questions I'm asking throughout the session is really to spark some thought on what we can potentially discuss at the end of my presentation, and to learn more about what they need and what opportunities there are for ACS and other organizations like the Texas HPV Coalition to collaborate and help make improvements on these processes. Then also access. If you do not have a school-based clinic, do you provide mobile clinics? Do you allow them to come to vaccination events, or do you attend local regional events? There's a lot of great opportunities to collaborate with your local health systems in your area, and oftentimes I think both parties are eager, but how to get those relationships going is really valuable. And so if you do have an interest, whether or not you're a health system or you work within the school system, reach out to your local American Cancer representative, and they can really help leverage their expertise and also relationships to help make movement around school-based vaccination clinics or mobile clinics or larger vaccination events that often happen regionally. So being able to identify those large local and regional opportunities is critical. And that's where that building education and bridging partners is huge to utilize each other's resources. Now we're moving, kind of shifting gears a little bit, and the project I manage focuses directly on HPV, the human papillomavirus. And I would love to learn, and again in the chat box, a yes or no, is HPV vaccination a part of your school adolescent immunization education and or protocols? And if you are not part of a school system, maybe a part of a clinic, have you done a mobile clinic or event with a school where HPV vaccination has been a part of that vaccination protocol? So just a simple yes or no in the chat box would be incredibly helpful. And again, we can talk more about this at the end of the presentation. And so I bring this up because to have an opportunity through a vaccine, and American Cancer Society, our goal as a nation by 2026 vaccination to start eliminating 6 different cancers. And before I move on to the next slide, if anyone knows, and again, I can't see the chat box, so this is just kudos to you if you do, other than cervical cancer, what are some of the other HPV related cancers? There are 6 of them, including cervical cancer. So before I go to the next few slides, I'll let you think about that before we get to the list. So see if you can list them out with the help of others. I mentioned the Texas HPV Coalition earlier. This data is from the CDC, but it is represented on the coalition website, which I've provided a link down below. And Texas only has 48.4 adolescents up to date on the HPV vaccine. And so the next slide I'm going to show you is really going to put in perspective of the gap between HPV vaccination completion rates and Tdap and meninge. And unfortunately, we currently rank 41st out of 50 states in the District of Columbia for up-to-date HPV vaccinations. So we have a lot of opportunity for improvement, even before the pandemic hit, but even more now. And why Texas is so important to the nation is we have such a high percentage of adolescents in our state that can directly impact herd immunity in the nation, similar to California's population size, and really directly impact the completion rates across the nation, because we're big old Texas and we have a lot of work to do, but a lot of opportunities. So this is the slide that I was pointing out that really looks at the comparative data from 2006 to 2019. And we're looking at Tdap, meninge, HPV from initiation to completion. And so you can see that right now, so in 2018, that's when the last data, this sampling frame estimates, is that we see a 71.5% initiation and series completion. And that's absolutely fantastic. But what we really need to do as a nation is increase our completion rates for HPV vaccination to reach, as you can see at the top, where Tdap and meninge is. These are vaccines that can be co-administered around the same age group. And so this demonstrates that preteens and teens are going to the doctor. They're also getting at least one of the recommended adolescent vaccines. So that really represents a significant opportunity to increase HPV vaccination rates and potentially create herd immunity and decrease 6 potentially preventable cancers. And so with that, why do we focus on HPV? So we've already mentioned that it can prevent HPV-related cancers. We also need to vaccinate more kids. So the more that we focus on this, we can help increase, like I said, rates in Texas, but all across the nation with how large our adolescent population is in Texas. And really success is achievable based on just the data I presented, is that people are going in and getting their wellness checks for their children, and they're getting Tdap and meninge. So there's an opportunity, or I should say there's missed opportunity to focus on really recommending HPV vaccination. And there's a lot of power that can be done in educating through school nurses and education to parents through PTA and newsletters. And so for those of you that might have took a stab at putting the different HPV-related cancers in the chat box, this is another reason why it's so important to focus on prevention, so the HPV vaccine, because cervical cancer is the only cancer that can have routine screening. All of the other 5, unfortunately, do not have routine screening options. And as you can see, like, that's substantial. And we have high rates of cervical, but now that we're having a better understanding of assessing HPV-related cancers, we're seeing a higher increase in throat cancer caused by HPV-related viruses, more so now than ever, and it's surpassing cervical cancer. So we really need to focus on all of them because of the lack of routine screening availability. And then really just to review some guidelines around HPV vaccination, it's recommended between ages 9 and 12. And really the vaccine can start at age 9 and 10. And many health systems and providers actually prefer recommending at 9 or 10, which is, sometimes a learning experience for them and also for the systems as a whole, because they find that parents are not thinking about whether or not their kids are sexually active at this age. And when we're focusing on cancer prevention, that is truly what they hear. And both kids and parents prefer to spread vaccinations out. And so if you were to get the HPV dose, first dose at age 9, you could then get the second dose at age 10, and then only Tdap and meninge would be administered at 11 and 12. And more kids get well-check visits at 9 and 10 compared to those pre-teen and teenage age. And one thing that I do want to point out, that if you see that on time is 9 through 12, but you can vaccinate late through ages 13 to 26. The reason why we really want to prioritize before the age of 13 is because the immune system of children and the fact that they are less likely to be sexually active, that there's a higher success rate to vaccinating young. And so as we get older into 22 and 2026, there's a higher chance that people have already been exposed to the HPV virus, one of the viruses. And the other thing is, once you turn 15, the dose increases the series to 3 doses, which no one wants an extra shot, and parents don't want to bring kids in for an extra appointment. So there's a lot of win to looking at that on time, which is circled below. And so really in closing, I've mentioned, many school-age children missed recommended vaccines over the last year due to disruptions of COVID-19, especially concerning our gaps for measles vaccines and vaccines truly recommended at 11, 12 years of age. And schools may not have focused on compliance with school vaccination requirements during 2020 and 2021 because of the decrease in vaccinations that we did have. And so into the coming school year, we do see that there's going to be less flexibility in delinquent vaccinations, and we need parents to bring their kids in to meet compliance rates. And the thing is too, is we don't know what's going to happen with COVID-19 vaccine, if it will be available for younger children under 12, but as of right now, it's not. So we can't really count on that being administered with other vaccines simultaneously or within those 2 weeks we mentioned prior in the presentation. So we really need to focus on getting kids caught up now on vaccine doses they've missed. And this is all vaccination requirements for schools and the recommended vaccines to return to that in-person learning and allow not only the community to be healthier, but to prevent the passing of these preventable illnesses. And so truly the call to action that I want for everyone is to find a way to provide adolescent education by prioritizing immunizations now to catch up on missed vaccinations. And this photo here is an example, and you can actually click the photo once the PowerPoint is sent out to be able to see other forms of this that's marketed in different avenues. This one's more focused on, the safe return to school, but also oftentimes we need to adjust our action plan based on missed and due vaccines. So going back to those vaccination protocols within schools, when's the last time they have been updated? Is that something that needs to be reassessed? Do you need help with that? And so our post surveys will really allow opportunity to provide you an opportunity to get assistance if that is something that you would like, whether it's MTRAC 2, helping with implementing and partnering with local hospital systems to create vaccination events, and even just revising your protocols and learning about how to adjust your consent forms. And we'll be hearing more about all of that tomorrow during our panel discussion. That is what I have for now. I also, before we get in Q&A, just want to share that at the end of this presentation, there are a ton of different resources available to you. And so at this point, I am going to close out the presentation so we can actually see all your lovely faces in the chat box and see if there are any questions or discussion topics that we would like to dive in deeper. So let me see if I can stop sharing my screen. And I know I went through a lot of information incredibly fast. This session is also being recorded, so you'll be able to share out and look through it again if you do have any additional questions or needs. But I'd love to open it up to see if there are any questions or comments based on what was brought up in my presentation. And I do see that there are some comments in the chat box regarding just, a lot of people aren't aware of the multiple cancers related to HPV viruses. And to just go back historically, specifically in Texas, in around 2006, the vaccine was only recommended for girls because hoping that if girls received the vaccine that it would create herd immunity. But we just saw an increase in male throat cancer and the other HPV related cancers. So thank you for mentioning that yes, most people focus on cervical cancer, but there is a lot of missed opportunities there, specifically with boys, to increase rates there. Oh, and I see I'm scrolling through. I see a lot of people answering the different cancers related to that. But I'm going to just stop talking for a few minutes, practice my pregnant pause that I'm awful at doing, and see if any of my colleagues or anyone else on the phone has comments. And feel free to come off of mute. And Karen, I apologize to call you out. Could you, you said there's a webinar available for superintendents?
So last week, it was a combination of the American Academy of Pediatrics, the Texas Pediatric Society, and the School Nurse Organization. And we did conduct a webinar. It was advertised and will be available on recording through TASA, which is the Texas School Administrator Association. I'd have to really look up those acronyms, but basically it's the superintendents and assistant superintendents. And again, the information was to educate them on what HPV and flu in particular are, because those are the two vaccines that are not required, but very much recommended, and how we might look at bundling them with the other boosters that are needed for entering 7th grade. We also addressed COVID in that situation too, that it can be the other one that's recommended but not required.
Oh, that's absolutely fantastic. And you said those have already been recorded. It's just now they're going to be promoted out as a recording.
Yes, we filmed it live last week, I believe on the 14th. Okay. And it will be available. I don't have the recording right now, but I can find out that information for tomorrow's presentation.
That would be great. Thank you so much. And one thing I do want to comment on too, that, you know, with Mission HPV Cancer Free Texas, we work with a lot of hospital systems and health centers. And, you know, we're trying to figure out, are people actually co-administering COVID-19 with other vaccines? And from the providers I've spoken to, process and protocols have not changed to, at least for the few I've spoken to, is that they are, if someone puts in that they want the COVID-19 vaccine, that is all that they're going to get. But I believe if they're coming in for a well check or a physical or whatever it may be, and they are behind on vaccinations, that then they can then provide a bundling approach to the vaccines. But I think it's something about how, whatever the system is, if they do just come in for the COVID, that some places aren't changing protocols on that. So that's really interesting. But also it's new, and processes and protocols take place or take time to develop. One question I do have, and I don't know how many school nurses directly we have on this call, but you know, I've always thought about, do nurses, if you had, say, you had the green light on all levels of supervision and superintendent to actually put shots in arms and vaccinate on site in your school, would you, is that something that you would want to take on as a responsibility as a school nurse? Or is that something that you would feel more comfortable, or due to your capacity would rather refer students someplace to get the vaccine? That is a question that came up, I think last week. That's just really interesting to think about, is, you know, there's a lot to learn. Do school nurses want that additional responsibility if they don't have an in-house vaccination clinic? And so, that's just a thing to think about as well. And I wish there's a way to talk anonymously in the chat. But, for tomorrow's presentation and panel, I'd love for you all to join. And if that's something that you feel, and I might even add it to the post survey after this, just so that anonymously you can answer that question, because we don't want to push things on school nurses if that's not of interest to them. Any other comments? Yeah, and I see that there's some comments in the chat box about opportunities for the superintendents or administration to be able to attend these sessions. Obviously, we shared this out as large and as wide as we could. And the focus was school nurses, because we do know that you have a good understanding of your student population, probably too much sometimes, but also you have an understanding of what's capable within your school district. And so the session's recorded, tomorrow's will be recorded. I'm gonna be sharing out the PowerPoint, and I would, if anyone has any questions or wants to follow up, there's gonna be opportunities within the survey to get some correspondence from myself and colleagues after these sessions. But yes, storage and consenting. Yes, and that's the other thing. Dana brought up storage, consenting, and how different vaccines like the HPV vaccine, COVID-19 has to be refrigerated differently and has to be separated, and then it's expensive, so reimbursement can take a while. And these are a lot of things that we're gonna kind of talk through tomorrow during the panel session. And the other thing we found out too is oftentimes school nurses are the ones that are required to either develop or update processes and protocols for their school district, and adding that onto their plate isn't sometimes realistic. And yes, Karen, contracting with mobile clinics and vaccine delivery. And, I do know that we have some folks on this call that are part of local health centers or hospital systems. And, within the survey, we're going to try and see if there's any sort of opportunities to connect people that do want to do events or have contracts with mobile clinics and vaccine delivery. So great addition. And someone asked if there's ACA reps in Deep South Texas. I'm not familiar. Is anyone on the call familiar with that?
Are you talking about ACS? Did you mean ACS?
I was maybe good problem solving, Shay. I was like, ACA, I'm just gonna act dumb on this one. Yeah, and so we have our ACS field staff aren't as large as we used to, but we do have staff that cover large regional geographic areas. And so if you're looking to connect with someone within your area, reach out, and I'll put my information in the chat box. And Shay, is there any other protocols that we usually have for folks to find out who we have in the area now that we don't necessarily have offices?
Well, I mean, I think it would be okay for us to provide the cancer control contacts in South Texas, which is Donna Rankin as well as Kayla, right? Would I be speaking out of context? Okay. Well, we can follow up with you and provide this directly to you, their email information. Do you want me to just put yours in the chat for now?
Yeah. Okay. And Shay too, we can talk about if it's appropriate to share like the geographic locations of our ACS staff, and if they're probably on this call like excitedly cringing because they love this work, but it's a lot. So oh, and I see that there may be some issues with joining the lunch and learn. Okay, we're gonna have to problem solve that. But any other, that's a really great question. because the staff that Shay's directly talking about works directly with local health centers, organizations. And so oftentimes we know Texas is big, there's stuff going on and we don't know it even in our local communities. Oh, okay, great. There's a school-based vaccination program in Rio Grande Valley. That's awesome. 4 counties. That's incredible. And Iris, who are you with again? Okay, UTMB. Okay, that's right. Awesome. We have in my my clock is on my computer is actually right today. Anything else? Any other questions? Yeah, and feel free to email both of us if if that's easier too, and one of us can directly respond. And Donna, thank you. You're so sweet. She provided her information as well for the Deep South people on this call. All right. Well, now that we had, now I'm going to actually try and do my pregnant pause, and I'm going to look for the post survey link, and I'm going to put that in the chat box while I give some folks some time if they do have additional questions. Oops. And just to let you know too, if you are participating or sharing information about tomorrow's session, it's going to be the same exact Zoom link as this session. And so, and I apologize if people had some issues joining today. Once you're registered, we then have to send you the calendar information because it's not a streamlined process. So thank you for your patience. And if that is all, I'll stay on the phone. And if people have any other questions, I'll be here. But otherwise, thank you so much for your participation today. I cannot wait to scroll through the chat box and see what activity was happening.